One of the most difficult things about using illicit drugs during pregnancies is that it sets the moms up for premature labor. Very frequently it compromises the amount of oxygen that the baby's getting through the cord. It creates bleeding potential problems, placental previa, placental abruption, and so it can be critically significantly poor outcomes for both the baby and for mom. So the sooner that she can get help and get on consistent medication that is prescribed by a provider who understands her abuse issues and can help her maintain as healthy a pregnancy as possible for the baby, that would be the best possible scenario. Usually babies do not show signs and symptoms of withdrawal the first few days after birth. So what we decided to do was to follow the AAP, the American Academy of Pediatric recommendations for keeping babies and monitoring them for withdrawal for at least 5 days after birth if we have a mom who's known to have used drugs during pregnancy. That way, when the signs and symptoms start showing up on day 3, 4, or 5, we're actually still able to treat the baby and take care of the baby here to get great health outcomes for the baby. A baby will show signs of jitteriness. They might have generalized tremors. They get really stiff. Their arms and legs get really stiff. They might have inconsolable crying that just goes on in spite of being fed and diapered, and all the other comfort measures were used. They can have GI symptoms such as vomiting and diarrhea. They can have autonomic nervous system symptoms such as fevers. They may have respiratory issues where they're very congested and sneezing and having difficulty with rapid breathing, or it can be the opposite, that they can have a period of apnea, in which case they don't breathe at all. They just sort of stop breathing for an extended period of time. All of it can end up being a very difficult situation for the baby because they could ultimately develop seizures, and they're just not able to withstand the withdrawal symptoms the way an adult can.